Hi, this is Dr. Yoon Hang Kim. I'm an integrative and functional medicine physician. I'm also an expert in low-dose naltrexone or LDN. So today I want to talk about side effects because there you can get all kinds of side effects using LDN, and I'm seeing a trend um, that is can be avoided. It can be avoided that if the prescriber and physician are better informed. I think that starting, and this actually has to do with my earlier videos talking about what is the optimal dose, because I believe that if you start with your optimal dose, you will avoid side effects. If you have side effects, then I think what I tell my patient is have 7 days of no symptom from side effect, give your body a chance to forget, restart maybe 1/10 or 100th, or some cases 1,000 times less. So, why do people have issues with LDN? And I think to answer that question, you have to kind of understand the mechanism. So, the mechanism for LDN to work, one of it is endorphin blockade. So normally you do the endorphin blockade and you may not feel as good, but some people it might trigger depression. Some people, and it's all individual based. And I do believe after working about 20 years with patients that there's a thing that they don't talk about called endorphin reserve. When one's endorphin reserve is low, then using the minute quantity of LDN would be optimal uh, optimal dose, and then increase I leave it to patients. I don't really have I do have a protocol, but I tell them, hey, it's just a protocol, it's a guideline, but you are the book, you are the true north, so follow what works for you. That's what I tell my patients. The first step, I think, has to be LDN prescriber involved because they're writing the prescription. And I saw a post saying that they passed out. Yeah, I think that's possible because if you once you do the blockade, everyone is wired differently. So the answer to most symptoms to me is to stop for 7 days. Ask your prescriber to lower the dose, maybe by 1/10, 1/100th, or 1/1000. And I got interested in doing this because I started LDN in high dose, and I had side effect all night, and I didn't want to take LDN, look at LDN, think about LDN for about a month. So based that on that experience, and I tell patients if your dose you have side effect, just put it in the refrigerator and come back to it later as you have built tolerance to it. And so when everyone was doing 1.5 milligrams, I recommended zero point 0.5 milligrams, and then when more people moved to zero point 0.5, now I'm starting everyone 0.1 milligram or 100 microgram, and I ask questions such as, do you have chronic pain? How do you sleep? If you don't sleep through the night, or if you don't have enough energy at the end of the day, or when you get up you don't have enough energy to get your day started, then even 100 microgram may be too much. And when in doubt, I go to 1 microgram. There's a video called When Do I Use 1 microgram? So I use 1 microgram when people have had severe side effects. And I would count passing out as severe. So most people, I think, will get through the side effects. But my point is, why do we? If you don't need to have side effects, why do you want one? If you have side effects, why not mitigate or uh, reduce it? And so in my practice, I think there are people who get side effects. I mean, I'll give you an example. I'll start LDN and MCAS or mast cell activation syndrome goes through the roof, or eczema gets worse, and for some people it gets better. And I think it just again speaks to the individualization of low-dose naltrexone is key to the success and comfort of using LDN. And then the other thing is that LDN was not meant to be uh, the uh, the only tool in my toolbox. I do have other tools. So inducing people into ketosis is another tool. Methylene blue is another tool. I don't like using it, but rapamycin is another tool. And there are other tools in terms of supplements. There are other tools that will help LDN to work better. And I think learning to use these is the art of the medicine. And one approach will help another person, but it will not hurt another person. I mean, it will not help another person, maybe even hurtful to another person. So I think it's wonderful that people are sharing. I think it's wonderful. But at the same time, I have to say, are you them? Are you the person who gave testimonial? So if you're not, a different story may unfold for you. And my goal is to get people to experience LDN success. And I think that's possible, up to maybe 80%. It's possible. So thank you so much. And if you like the video, please give me a like, give me a share, subscribe, and hit the bell to be notified when I record more videos. Oh, by the way, I'll be doing a lot more functional and integrative medicine videos as well. So if you have an interest, definitely hit the bell, then you'll get notified. Thank you.